Abdominal aortic aneurysm is something that we've actually recognized for a long time. We know that if we can treat it in time, our patients do great. But the trick with it is we have to catch the disease in time. By the time our patients unfortunately show up to the ER with a ruptured aneurysm, about only 30% of those patients had a known history of an aneurysm. Essentially, it's a dilation of the aorta. And so when the aorta dilates, there's only so much that it can tolerate, the tissue surrounding it. So as it dilates, it starts to compress on the arteries and the tissues around it. So you have issues from that. The worst complication you can have is it can rupture, it can break. And that means blood is gonna spill out into the belly. Even if that happens, we have very talented surgeons that can take care of that problem, but our goal is to prevent that from happening. Our smokers above age 65, they need to be screened, family history of aortic aneurysms, or they have different other peripheral vascular disease. We certainly have to have this disease entity on the back of our minds. So the only actual treatment that really helps is stopping smoking. This is a disease that's very prevalent in smokers. And so stopping and cessation of smoking actually helps a lot. Apart from that, the real treatment comes down to surgical or endovascular repair. Once we recognize the disease to how we get to treat it, that time frame has to be shortened. One of our strong suits is really streamlining that process, getting the patients that need treatment right to whether they need to go to a vascular surgeon, an endovascular specialist, or be treated by medications. So I think we're very good at that.